Today I'd like to open us up by sharing a little bit about our vision and mission here at Southcentral Foundation. Our vision is a Native community that enjoys physical, mental, emotional, and spiritual wellness, and our mission is working together with the Native community to achieve the wellness through health and related services. The acronym for Southcentral Foundation is SCF, and it represents our goals as an organization, which are shared responsibility, commitment to quality, and family wellness. This next slide represents customer ownership and what most healthcare organizations refer to as maybe patients or clients. Here at Southcentral Foundation, we call our patients customer owners. And basically what customer owners means is that our customers have a say in their health care. They have a voice. They can go in and they can ask questions and offer feedback, and it really allows them to really own their own health care, which in return makes higher success rates here for making people healthier. Now we review our operational principles. As I explained on the previous slide, SCF is owned by the people it serves. Our culture is lived out through all of our operational principles, which, as you can see, is based from the word relationships. We have always lived our lives in community and relationships, sharing and caring one another. SCF really believes in whole body wellness, and in that it's just important to take care of spiritual, mental, and emotional health as it is physical health. I'm not going to go through every piece of the operational principles because you can see them there, but just to highlight a few, as we said before, relationships is really something that we strive here at Southcentral Foundation, relationships between customer owners, family providers, as well as employees. We also emphasize on the whole person and family and community as well. We try to make sure our hub of the system is the family, and services and systems build on the strength of Alaskan Native cultures. So that's just a few operational principles I wanted to point out. Next, I'm going to talk to you a little bit about core concepts. And core concepts is an SCF training that all employees are expected to attend. During core concepts, we learn how relationships impact customer care and the value in not just building healthy relationships, but really also maintaining those healthy relationships. Core concepts also gives us an understanding of different relationship styles. It teaches different tools and techniques to apply in our daily lives at work and in the community, and how each person's story really has an impact on our customer care and employee engagement across the whole organization. Core concepts is all about wellness, working together in relationships to learn and grow, encouraging understanding, listening with an open mind, laugh and enjoying humor throughout the day, which is my favorite one because I always get the giggles, so that's good to know that we can laugh here at work. Notice the dignity and value of ourselves and others, engage others with compassion, share our stories and our hearts, and strive to honor and respect ourselves and others. Now that we've had some time to talk a little bit to you about who we are here at Southcentral Foundation, I'd like to take a moment to introduce the objectives for our webinar today. Basically, during this webinar, we hope to explain the voice of the customer is important, or why the voice of the customer is important. Identify your customers, discuss various ways SCF listens to the customer, and determine ways to access the voice of the customer. Also, we want to describe how the voice of the customer is used for improvement right here at Southcentral Foundation.
So what is a customer owner? So Stephanie, I know you have a few kids, so how did you explain to them what it means to be a customer owner?
Sure. So, basically being a customer owner is that no matter what age you are, you have a voice. You have a say in how your health care is going to turn out. What I talked to my small children about when we first moved here was the fact that it doesn't matter how old you are, you get to go in and talk to your doctors and your nurses. You get to ask them questions, and you get to tell them if you do or don't like things. And so by allowing people of all ages to really participate and own their own health care, what we found is that it helps to make their bodies healthier, and the kids understand that, the adults understand it. So it really has had a good impact on our healthcare system here at Southcentral Foundation.
Awesome. Thank you.
So how did customer owners gain a voice? We'd like to take a look back first at the old hospital where we used to be before we look at where we are now. Lizzie and Rachel, I know you ladies have been customer owners here for a while now. So could you take some time and share a little bit about what it was like at the old hospital and maybe some experiences you had there?
Absolutely. I'll start. One of the things that I remember is going to the dental clinic at a very small age. That really seems to be the only recollection that I have of, the old services that we used to have in the old buildings. But I remember it being very dark, open units. There wasn't a lot of privacy, which is definitely intimidating as a kid because you can hear things going on next to you, adults in emergency situations, and it was kind of a little uncomfortable and uneasy, especially being a kid being excited to go to the dentist and then hearing weird things next to me. So it's definitely a little bit awkward.
So I personally never went to the old hospital just because my mom and my grandma both had really bad experiences. But my mom and my grandma did share a lot about how dirty it felt and how unappreciated you felt, and the long wait time, so you'd only go in through the emergency room and then you'd have to just sit for hours and hours, sometimes 7-8 hours waiting for an appointment. So I was actually recently talking to my mom, and she was in a car accident and she still had to just wait with everyone else for 7 hours to just even get seen. So it was just very bad care. We weren't really respecting our patients.
Thank you so much, ladies. And as you can see by the picture of the old hospital, it just doesn't look real friendly. It looks dark. It looks scary. People were complaining about long wait times and not getting the services they need. So now we're going to take a little bit of time to show you what we look like now. So now this is our Alaska Native Healthcare campus, and here's a picture of some of our happy customer owners. Would you like to share a little bit more on that, Lizzie?
Yeah, so before we were where we are today, our old hospital was run by Indian Health Services, and at that point there was a lot of dissatisfaction with visits. Like we said, there's a lot of problems when people were going to go to their visits there. And so what happened is when ownership was transferred to Southcentral Foundation, we wanted to know what exactly people felt about the hospital. So we actually had a third-party vendor come in, and they surveyed our customer owners in 1993 just to kind of figure out what was really wrong and what was really impacting people. And we found out, of course, the long wait times was a big issue. It was a super outdated system. It was not designed around the customer. There was no secured medical records. You carried your medical records with you to your doctor's appointment. And then there was also a very increased demand for service. So those were all the things we wanted to address and improve with our new hospital.
Wonderful. And so we know that there's many of you joining in with us today, not only within the U.S., but also internationally as well. So we'd really love to be able to hear who are your customers and how do you listen to them? Again, that question is, who are your customers and how do you listen to them? So please go ahead, grab your phones, go to www.menti.com and enter the code 49203. And we look forward to hearing your responses.
Thank you, Rachel. So while we're waiting on responses to come in, we'd like to talk a little bit about listening to the voice in our NUCA system of care. SCF has a variety of listening posts. As you can see on the slide, some of our listening posts include personal interactions, social media, SurveyMonkey. We have our CEO president is available by email directly, so people can reach out to her on their own. We also do a lot of different types of surveys, like customer satisfaction surveys, employee engagement surveys. We have the 24-hour hotline. We have focus groups here at SCF. We also do the NUCA conference. We have annual gatherings. And then some more formal things as community leadership, advisory committees, as well as the governing board. So that's a little bit of a snapshot of some of the posts here that we have and how we listen to the voice of the customer.
All right. So who are your customers and how did you listen to them?
Did you get some responses you want to share first, Rachel?
You know, on media sites I am not, but it looks like we do have a question. Regionally, someone had stated we send surveys by mail after encounters.
Awesome.
Okay. So thank you.
So there's a variety of ways. Like we said, we listen to the voice of the customer, and there's all sorts of different feedback we get. So we have to filter that feedback so it's easier for us to deal with. So We have three main tools we use to filter all of our feedback. So we use the customer satisfaction survey, we use the employee engagement survey, and then we use our incident accident reporting system. So we started doing surveys, and what we did originally is what would happen is we would collect all the people who had visits for the year, and what would happen is at the end of the year we would send out the surveys to all those people. And so what was happening is we were only getting responses if people had a really, really bad visit or a really good visit, because you're not going to remember the okay or the average visits that happened over a year ago. So we were getting very, very minimal feedback, and none of it was very valuable because it was only those very extreme visits. So we knew that the system wasn't working, and so we wanted to pilot something new. And so what we did is at 2012, at our annual gathering, which is a big community gathering where a lot of our community shows up and a lot of our customer owners show up, we brought iPads there, and we had iPad surveys, and the question was mainly like, is this okay? Would you survey like this after your doctor's appointments? And we had very great feedback, and people said that they would love to do this. They would love to be able to provide immediate feedback this way. So in 2013, organizational development hired 2 employees, and their entire job was to survey customer owners. So they were in the hospital, they were walking around with their iPads, and they were stopping people and asking for their feedback and how their appointments went. And so this system increased our feedback a lot, but we weren't tracking it, and we weren't meeting our targets we had set for ourselves. So we had set targets with our goal number of feedback, and we still weren't meeting that target. So in 2014, we knew we could improve again. So what we did is we took those iPads and we actually put an iPad in every single department. And so now when you leave your doctor's appointment, you immediately walk out and someone goes, will you take a customer satisfaction survey? And it's immediate. It's right there. It's right after you have your appointment. So you're thinking about what happened. You're thinking about what went great. You're thinking about what didn't go so great. And we get all of that feedback. And so we saw a great increase in feedback. We were just getting so much great information, and we were finally meeting our targets. And what we did with that data is we put it into our data mall, which is our system that houses all of our feedback, and so we made that accessible to everyone. So now everybody who works here has access to those scores so they can see how they're doing and how we're doing as an organization.
Thank you, Lizzie.
So as you can see, this is our satisfaction response rate. So you can see in 2011 and 2012, we had very, very low scores. And then you can see that first jump in 2013, and then the continuous increase to 2014 to 2015. So we're gathering a lot of feedback. That's a lot of feedback to receive in 1 year. And something you'll notice is in 2016, it is a little bit lower. So,
oh no, it looks like there was a decline in the response rate. So Lizzie, could you talk to us a little bit about why maybe that could be a good thing?
Yeah, so we did have that decline, and that was a direct response to feedback we received. So we were receiving a lot of feedback that people were getting surveyed too much. So what happens is, imagine every single appointment you go to, you're getting asked to do a survey. It becomes very, very overwhelming. And so we got that feedback that there was just a lot of survey fatigue and we needed to slow it down. So what we did is we got together with our data experts and we found out that we could lower those targets and still be making statistically significant data. It was okay to lower those targets. We would still be getting the same scores. We would still have the same satisfaction rate. We would just be asking customer owners for less surveys. And it has improved. We haven't been getting complaints that we're over-surveying. People think it's about the right amount of surveying. But you do have the opportunity, if you're at a doctor's appointment, to say, I want to do a survey, even if it's not offered you. You're allowed to ask. You're allowed to offer your feedback, and we definitely appreciate that. That's great. So now this is just the comparison of our complaints versus compliments. So this is a way we review our scores just to kind of see where we're at yearly. We like to compare and contrast. So as you can see, our 2015, 2016, we get way more compliments than we do complaints. And that's very, very exciting for us to see how great people think we are. People really do love the services they're receiving, and that's great for us to hear. And you can see there's barely noticeable, but a little bit decline in complaints, which is very exciting as well. That's great. So the next thing This is what that iPad survey looks like. So when you go after your appointment, you're handed an iPad. This is what it looks like when you take that survey. So you see we ask all sorts of questions. We ask when our appointment's available. I would recommend to my family and friends. The program was clean. I'm overall satisfied. These are just all things we think are important to find out from our customer owners. And so we have the 5-point scale, and so when anyone selects disagree or strongly disagree, what's going to happen is a little comment box is going to pop up, and they're going to be prompted to tell us why. Why were you dissatisfied with the visit? What can we do to improve it? Because we need to know. We don't want anyone to be leaving appointments dissatisfied over anything.
Absolutely.
So we gather all this data. We gather tons of feedback. You saw how much feedback we get every year, and so then what do we do with it? What do we look at? So in our data mall, all of the general survey scores are there, and that's the iPad survey. We have a few departments who do things a little bit differently, just based on the population they serve. For example, our elders program, their surveys are different because they usually have people who are there every single day, so we don't want to be asking them this long survey every day. And then like pharmacy is different just because a lot of times it's people who go every single month, and we don't want to be asking them the same long survey, so that survey is a little bit shorter. But all the other clinics are expected to be doing just the general iPad survey. And so we look at those scores, and we look at only the positive scores. And so the positive scores are the agree and the strongly agree. And what we'll look at is we'll look at that by month, by division, and then we'll break it down to department. And that's as far as we typically go when we're sharing those scores. But you do have the ability to drive down into provider team. And the only time we'll really do that is if we notice a trend with the provider and we notice that they're doing really, really great and they're really excelling and they have 99% overall satisfaction score. And what we'll do is we'll actually go and talk to that provider and find out what are you doing that's so great, and then we can share those best practices with the rest of the organization. So then everybody can be using this great model that they have set up.
And just to add to that, one of the unique things that I feel is really cool in the clinics is in the back of the clinic area where all the physicians and the team sit, they actually hang their scores up on the wall, and they look at them on a daily basis, and they're constantly, looking at what we can do better. They're getting together as providers to say, hey, your score's really good, what are you doing? Or, hey, your score's really low, what can we do to help? So it's really neat to walk into those clinics back there where our providers and care teams sit and see that they have those posted on the wall, and that they're really watching it, and it is really important in what the customer feedback is.
Yeah, I think it's great. We have every month, we have monthly targets set up for our departments, and by the end of the month, everybody is calling because they all want to reach that target, and everybody wants to know they hit it because they want to know they really care about that feedback and how great they're doing. So it is great to see it in the clinics and everywhere you go. So this is the view of the data mall. So this is the view that everybody has access to. And so you can see this is just for the first question, and an appointment was available when I needed it. And you can see it drills down to the organization, SCF as a whole, and then we can go to the division and then down to the department. And if you actually hit the department, that's where it will drill down into the provider teams. And so like I said, what we look at is that positive score, and then we can also view the N sizes, the amount of surveys we got in that month.
Wonderful. Well, thank you so much, Lizzie. We really appreciate that. And what we would really like to know is how have you used customer data for improvement within your organizations? Again, grab your phone, go to mentimeter.com, and enter in the code 49203 so we can see what your responses are. Do any of you guys have good examples of how you guys have used data within your work areas? Or I've also got one as well too.
Sure. I have a great example to share while we are waiting for the feedback. One really example that comes to my mind is that our customer owners were in need of more behavioral health services. And so not just the customer owners, but the providers as well. So what we did, we got the information, we got the feedback, of customer owners needing more behavioral health services. So the way we responded to that and the way we made an improvement is we actually placed behavioral health consultants in all of our clinics. So they're on the teams with the providers. And so basically when you go to an appointment, if you have a behavioral health care need, it can be, we can meet those needs immediately. It could be the provider goes and talks to the behavioral health consultant and says, hey, I have a customer owner. These are the needs that they have. Or it may mean that the customer owner needs to see a behavioral health consultant and they are able to get same day access right then and get the consulting they need. So it's been really great to add the behavioral health consultants to our primary care clinics.
Wonderful. Thank you so much. And it actually looks like we have a response. It says, how have you used customer data for improvement within your organization? And they said text and phone. We just got another one which says, with survey responses, we work with teams to Pdsa things like addressing access, wait times, etc. Another one, survey results help to determine goals for upcoming years. So thank you so much for sharing that. We really appreciate your feedback. And just to kind of share a personal experience as the improvement specialist for dental services, one of the things that we were noticing was we were getting a lot of customer owner complaints because dental had a different what we call BA rate compared to the rest of the hospital, BA meaning broken appointment. So customer owners would show up to the dental clinic, and because we had a different time frame in which customer owners were to make it to their appointment, time in which they had to make it to their appointment before we gave it to a standby customer owner waiting to be seen, it was very confusing for customer owners. So by taking in that feedback, we were able to recognize that we needed to change something and kind of go similar to what the rest of the hospital was doing. So that was a change that we recently made within dental in regards to how we were using data. And it also looks like we have more responses on the how have you used customer data in improvement in your organization. Let's see, measure appointment satisfaction, drives improvement initiatives through the year, strategic plans. Yes, our database is accurate with trends of the illness. The survey would help. So thank you again for that feedback. And we'll go ahead and, oh, it looks like another one. Thank you. You guys are responsive with us today. It looks like surgery responses help create more personal and better flowing appointments for our customers. So thank you. We love that. Anything more before we go ahead and take a break? We're so excited to have you guys, and thank you so much for joining us with South Central's Foundation Voice of the Customer webinar. It looks like we don't have any more responses at this time, so we'll go ahead and take a quick break. So please come back and join us, and we have a lot more wonderful information to share with you. All right, well, thank you for joining us back here at South Central Foundation Voice of the Customer webinar. We're excited to have you guys back, and thank you for taking our little break with us. We appreciate it. Just to kind of go over the Menti.com questions, we wanted to go over the who are your customers and how do you listen to them. So some of the responses were statewide service, and we all get feedback differently. We want iPad surveys. Most of my customers are seeking behavioral health services, and I actively listen utilizing motivational interviewing. Regional, we send surveys by mail after encounters. One of the ones was text, phone calls. I attend home care clients home for visits. First Nations, and how did the community members adjust to the NUCA model? Was there any resistance? Do any of you ladies have an answer to that question? It was the how did the community members adjust to the NUCA model? Was there any resistance to that?
So I'm not sure if we had a lot of resistance to that. Anytime there's a change, whether it's a good change or a bad change, it can be uncomfortable for some people and it can be a little resistant. But overall, because the NUCA model is more customer owner friendly, and it really gives them that voice and it allows more services. So for example, as a customer owner, I have a provider that I see on a consistent basis, and our providers work in teams with their case management support and their scheduler and their RN case manager. And so it's really neat for me to be able to just pick up the phone and say, hey, can I get an appointment today? Every now and then they'll say, well, your provider's booked. Would you like to see an alternate provider, or we can reschedule at another day with your provider? So although you may think there's resistance to change, it was such a good change for our customer owners that people really love it. They love the fact that they can go to the same doctor. They don't have those long wait hours. They can get additional assistance. You know, we have resources not just in the clinics, but also across campus. So it has really had a good positive impact. So I would say no, not too much resistance, but we were aware that some customer owners might not be comfortable with that. So we took time to build those relationships. We talk through with them, and we really try to support them because this is really all about their healthcare needs. So overall, it's been really great for everyone.
That's great, Stephanie. I love that you say you can just pick up the phone and call your provider. I know for me as a customer owner, that's really something that's been very valuable, and I really appreciate that. Being a mom too, that's nice to be able to know that you have a number to call and you get direct responses and you get direct, you know, they're willing to just get you an appointment right away. So I do love that. So thank you so much. Any other comments, feedback? It doesn't look like we have any more Menti.com comments from the ones that we just read here, but did you have something?
Yeah, so just to share a little bit more, I see on there like someone said they attend home care clients home for visits. So we also have home-based health care here as well. So we do send people out into the health field to get those needs met, especially if it's some of our elders or people who can't make it into the clinics. So we really provide a lot of support for them. We also have care teams that fly out. So Alaska is a huge state, and it's not like you can just get in your car and drive up a highway and be somewhere. A lot of places we have are in remote areas like the villages where people have to fly in and out. And some places are only accessible by airplane or boat. So what's really unique and exciting for our healthcare is that we do have those teams that travel. They go out into the villages, they go out into the communities. So it's not just like we have everybody come here for their services, we also take the services to them. And to make it more convenient, most of the healthcare services that our customer owners need is right here on campus. So we have multiple buildings and multiple specialists. And so even if you go to your primary care clinic and that's a consistent doctor, you're still going to have access to tons of things right here on campus. So it's really good to see that other people are doing the same thing, taking it out into the field as well as here in the clinics.
Wonderful. Thank you so much, Stephanie.
Sure.
I really appreciate that. And again, just going back to the Menti.com, it doesn't look like we have any additional questions at this time. So we'll go ahead and let you guys go ahead and start with a voice of the workforce and why that's important here at Southcentral Foundation.
Thanks. So being improvement advisor for workforce has really given me the opportunity to really work with the organization as a whole and to take that time out and listen to what the workforce is saying. So in addition to hearing just the voice of the customer owners, we take great pride in hearing the voice of the workforce because it really makes a big difference when employees are feeling like they've been heard and that they're being engaged in. Some people may say, why do we listen to the voice of the employee? Why is that important? And so kind of where we think is happy employees equal happy customer owners. By listening to our employees, we found we could get a really good pulse on how committed they were to providing quality services and how determined each employee was engaged. So, you know, are they really engaged? Are they really caring about what they do? And so it's been really good to reach out and find those things out. Because we reached out and found these things, we learned that both of these, having people committed to quality and being really engaged, led to increasing our retention rate and reducing costs due to turnover. So that's been really great, giving the workforce that voice. And, you know, like we said, workforce employees, if they're happy, they're going to be providing better care and making our customer owners happy as well. Overall, we use the voice of the employee as an improvement tool as well. So we take back employee feedback and they say, hey, you know, we see maybe this isn't going well or that isn't going well, or we'd like to see, you know, more support in the clinics, or we need more support of the employees. So really taking all of their feedback and using that as an improvement tool has really been helpful in improving success rate here at Southcentral Foundation.
So our next Menti.com question, make sure to type in the code 49203, but how does leadership at your organization listen to the voice of their employees? Again, that question is, how does leadership at your organization listen to the voice of their employees? Again, grab your phone, go to Menti.com and enter the code 49203. And while we're waiting for those responses, Stephanie, when you were kind of talking about workforce, it looks like we have a question, so I'll go ahead and answer that first before I share. Through strategies and senior meetings and community gatherings, that's great. So that's how leadership within their organization is listening to the voice of their employees. I know in dental for sure that we are using that as well. That is on some of our annual plans, is things that we know that employees are saying to dental leadership. Hey, we need more communication, or we need ways to connect with our team members. And so those are ways that we have addressed as well on annual plans, is what can we be doing better to better engage with the employees. So I know that that's something that's important. It looks like we just had another question come through, and it says, employees of all levels are members of communities alongside leadership. Thank you. That's great. Any other feedback? Again, Menti.com, and you can enter in code 49203. We love your responses, so thank you so much for interacting with us today. It's a lot of fun and makes our job more exciting. Someone had mentioned employee engagement surveys, so we know about those. So yeah. So how are you guys using employee engagement surveys within your
We do
workforce?
use employee engagement surveys, so we actually currently are in the process of doing our employee engagement survey. It was sent out a couple weeks ago, and we are waiting on those responses. I know Stephanie has a big part in doing that every year and making sure every employee's voice is heard.
Wonderful. And we just had another Menti.com response, and it stated surveys was a way in which they're reaching the voice of their employees. So that's great.
Something really cool I know we just did recently is the vice president of our division actually sat down with our entire department, and she had lunch with us, and it was just an open sharing session, and she kind of just told us what she could tell us and just asked for our questions, and we were able just to ask questions and let her know how we were feeling and provide input on everything. And I think that was really helpful, and it was really nice to just sit with your vice president and feel like she really cared and connected.
That's great. So it looks like while you were sharing that wonderful information, we had 2 more responses come through, actually 3. And it looks like quarterly employee events. So that's a great way to get people excited about their work and their teams. Another one was employee survey employee internal board to provide feedback, meetings, and briefings. We had another surveys. And then internal website discussion board. That sounds interesting. I like that. I'd love to hear actually more about that. That sounds cool. Let's see here. All right, it looks like I think I got all of them. So thank you so much again. And we'll go ahead and give you guys another minute. Do any other feedback while you're collecting those surveys, Stephanie? I know you do a lot of work with those, so you're a busy woman.
So we're going to talk about the employee engagement survey here in just a minute, but one thing that comes to my mind about our leadership, and I don't remember if I mentioned it when we talked about core concepts, but our core concepts is driven directly from our senior leadership. Our CEO and president herself presents and teaches that, as well as vice presidents. And they sit along and they share their stories, and they really open it up to the employees. And then they receive feedback as well. And so our senior leadership team is very active in what's going on with all of our employees, whether it's through training, the annual learning event when they set that up, and they're very part of it. And during our annual learning event, every VP gives updates on what's going on in their division, and then they ask for our feedback. And I know a lot of surveys is how we get feedback, but it's really helpful after you've got to spend all day with senior leadership learning about what's going on in the organization, and then be able to say, hey, here's what we think. And they take that feedback and they listen to it, and they're accessible. And so it's not like they're just senior leaderships that we never see or hear from. They're always actively involved, and they model, for us. So it's really nice to know that our leadership really does listen to what we want and help implement improvements across the organization.
Great. Well, thank you so much, Stephanie. And it looks like we haven't had any additional questions come through, so I think we're safe to go ahead and begin finishing up with Voice of the Workforce.
Awesome. Thanks, Rachel. So here at Southcentral Foundation, one of our improvement tools is our employee engagement survey, which is administered through a third-party vendor. The reason why we selected to use a third-party vendor for our employee engagement is because we really want the workforce to know that what they're feeling and what they want to share and how they perceive the organization is valuable to us, and we want it to be confidential. So by using a third-party survey, we load the tool, we put the employee's information in, and when the survey is deployed, which we're in employee engagement survey right now, every time the employees log in and they answer those questions, it's all confidential. So we never know. We can see response rates. So I might know that out of the development center, say maybe they have 30 employees, 20 employees have responded. And so we really encourage and we send reminders out. We watch those response rates. We share those response rates within the organization. But we also try to let the employee know that, you know, we really want them to participate, and it's a shield to use a third-party vendor because they know that their voice is being heard, confidential, and they don't have to be afraid to share. And so we really like that. So basically, like I said, it's administered through a third-party vendor. All employees are invited to participate across the organization. Obviously, we take into account those employees who may be out for FMLA or for leave, and so we make adjustments for those. But outside of that, we last time I checked, last year I think we had like a 98% response rate. So it's really exciting to see that employees care and take the time to fill those surveys out. SCF uses results as measures. Here at SCF, we believe in transparency and there are no secrets, and so all employees have access to the results. We have a beautiful dashboard. Every employee has their own login, and once the survey is completed and the results have been released to the organization, every employee can actually go into the dashboard themselves and they can see what the results are. So it's really exciting to be able to share that with them. Action planning at all levels includes the voice of the workforce, relationships, and the planning process. Basically, our employee engagement survey focuses on 4 main areas, and that's how the questions are broken down. So the first one would be the organization, and when they answer the list of questions that feed into the organization piece of it, it really tells us how our employees are connected to our organization. The next thing that we look at is management. How are employees connected to their managers, and how are they feeling about their managers? So that's a really good one. The third one is the employee themselves. How connected employees are to their jobs, as well as how connected they are to their peers across the organization. Overall, how employees are committed and engaged is, so we take all the results, we look at organization, manager, employee, and then we look at the overall commitment and engagement of our employees. So it's a really good tool that we use here on campus. We do the survey once a year. It comes out at the same time every year so that it fits in with our strategic planning process. And as Lizzie mentioned, we are in employee engagement survey right now, so the employees are taking the surveys. And we usually run the surveys around the middle of April to the middle of May. As before we mentioned, some people were feeling that survey fatigue, so we strategically plan things like when we're going to survey the employees. So for example, you know, we do 360 surveys, we do SurveyMonkey, we do employee engagement, we do evaluations. And so what we did is we looked at the strategic planning cycle and tried to place and spread those apart so that they weren't getting like 100 surveys all in the same month. So it's been really helpful and really helped our response rate. The next thing we're going to talk a little bit about is actively disengaged versus highly engaged teams. When you're thinking about actively disengaged versus highly engaged, some of the things we look at are, what are the qualities of the team? What is each person bringing to that team? What are they coming together to do? What kind of quality services are they going to be providing? So quality is really important. The next thing we look at is the impact on team performance. And so if you think about a team that's highly engaged versus disengaged, do you think a team would be more likely to perform or less likely to perform if they are engaged or not engaged?
More likely.
More likely. So what we found is that an engaged workforce, it impacts on team performance. It also has a big impact to our customer owners. So basically everything we do here at Southcentral Foundation is going to affect our customer owners, and so we take that into consideration. Some examples of maybe an actively disengaged team might be a team who they don't communicate well. Maybe they don't meet on consistent basis. Another thing is attendance. You know, if you are a part of a team that you really like, you're going to be more likely to attend those team meetings and be more involved. But if you're disengaged, you may not want to really be involved. You may not share your voice. You may not show up to the meetings. And an actively disengaged team can really show a lack of commitment and be poor performance. So, you know, the other side of that is a highly engaged team which we strive for here at Southcentral Foundation. An engaged team is basically just the opposite of a disengaged team. The members of the team are excited. We have subject matter experts. They like what they're talking about, and they really want to make a good impact. And we've noticed that when we have those highly engaged teams, that their overall commitment and success rate is much better. And it affects our overall performance here as an organization. So it's really nice to be able to interact and look at our teams and provide that support of the workforce.
All right, so just briefly, we're going to cover our incident accident reporting tool. So this is our third tool we use to bucket feedback. And so the incident accident reporting tool, obviously it's what we use to report incidents, accidents, things like slips, falls, pinpricks. What else is in there, do you think, Rachel?
Oh, lots of stuff.
You know, just anything that's accidental. The biggest thing we have in there is slips and falls, honestly.
Yeah. And is this just for customer owners, or is?
So this is for anyone. So this is anything that happens on campus is reported into here. So if it's an employee who falls or a customer owner who falls, it's going to be reported into the incident accident reporting tool. The thing about our incident accident reporting tool is we also use it as our customer feedback reporting tool. So what happens is when you fill out a survey, if you fill out that little comment box on the bottom, we're going to copy that feedback and we're going to put it into our customer feedback reporting tool so we can track that feedback. Because if it's a compliment or a complaint, we want to make sure it's addressed and it's dealt with and it's handled so that people aren't still having the same issue. So how we have all this data into our incident accident reporting tool, what do we do with it? So some of the biggest things we use this data for is to make improvements. The biggest things we make improvements for is to care processes and operations across divisions. So if we notice that there's a high trend in something happening, we're going to address it, we're going to improve it, we're going to notice that. The other thing we use it for is to increase awareness. So if we see large trends in access, aggressive behavior on campus, quality of care, and services, and like bad trends with customer service, we want to address that and we want to escalate that to our leadership and let them know we're seeing this trend, this needs to be addressed, we need to deal with this. And then lastly, the biggest thing we use the data for is to provide education. So we want our staff to be the most educated. We love training, we love providing education to people. So if there's a high trend in event types, we want to provide the education our staff needs to prevent that from happening.
So we have shared a lot of information over how do we listen to the voice and different types of ways that we listen to the voice of the customer. We've talked a little bit about customer owners, internal customers, which are employees. And so now we'd like to take a little bit of time and we want to shift and talk a little bit about how we respond to the voice. Because here at SCF, we don't just listen, we do actively respond. One way we respond is through our strategic planning cycle. And so I'm going to talk to you a little bit about how we respond to the voice. The first thing we do is we collect all the data, and we've talked a little bit about all of our data points, whether it's a customer sat survey, employee engagement survey, listening posts, focus groups, just to kind of recap a little bit about all the different data points we have here on campus where people can talk. So basically we get all of that data, we get all of that information, and then we ask, what is this data telling us? Is it telling us good things? Is it telling us bad things? Are we seeing trends? Do we need to make changes? Or are we just doing so awesome that we want to share with other departments and divisions what's working? So there's a lot of information we have that we have to process and we think about. Once we collect all the data and we get the information we need, we turn it into charts, knowledge, which is charts, tables, trends, graphs, things like that. We ask what conclusion can be drawn from the information, and this is really where we get that knowledge. So it is really well planned out, and we do step by step and take it all in, think about it, knowledge. Once we have all the knowledge and the information in front of us, we look at what to do with all this information and take action by creating improvement plans. And so basically, like I said, to recap, we collect the data, we turn it into information and knowledge, looking at trends, graphs, different things across the organization, and then we start our action plans, which lead to our improvements here at SCF. During the SCF strategic planning process, SCF it's broken into 4 different quarters here on campus. And so it's a cycle that's continuously going. We never stop collecting data and looking at data and trying to do something with it. Quarter 1 is what we would call our evaluation season, where we're identifying strengths and weaknesses, as well as aligning those with our PDPs. PDPs are performance development plans, and here at Southcentral Foundation, all employees are required to have a performance development plan. And kind of what that looks like is you sit down with your supervisor and go over, what are my goals for this year? What am I trying to get accomplished this year? And we also have ladders set up for promotion and progression. So if we have folks in a position that they're really looking towards promotion and progression, those opportunities will be outlined in their PDP, their performance development plan, to say, hey, here's what you need to get a promotion, or here's what you need to do for progression. It also gives us a chance to look at all the training that we need throughout the year and all the other opportunities we can participate in. So even though I'm improvement for workforce, it doesn't mean all I do is do improvement projects. I get to actively participate in trainings like these. We get to do training, we do learning circles, we do events. So it's really nice to be able to sit down with our supervisors and go over those performance development plans. And it also sets expectations on both sides of the house for the management leadership team as well as the employees themselves. During quarter 2, what we start doing is we're assessing things, environmental considerations. And so we're looking at things like, what are the risks, what are the threats, and what are the opportunities for growth? Risk and threats in the environment could be, things like how the economy changes or what's going on. For example, here in Alaska during the summer, a lot of people are out getting their fishing and they're doing their bear picking and they're preparing for those winter months. And so we really take a look at what's going on in our environment, what's going on here in Alaska, what's going on across the country. And so we really take that information in and consider it part of our strategic planning process. During quarter 3, that's when we do validation. We're taking information and align it with goals and objectives and initiatives into our strategic planning document. And then in quarter 4, that's during our planning phase. So we really take all the information, our strategic planning document, all the information we've gathered, and we put it into our annual planning tool. And that way we can define and prioritize what do we need to work on. And so every department and division across the organization has access to the annual planning tool, and different people are responsible for looking at those projects, looking at those annual plans, and really keeping us on track. So as you can see, it's not just we hear your voice and we're going to do something about it. We really have a strategic plan process in place, and it goes around the whole calendar year. We're constantly looking at how can we make things better, what are we doing right, and how can we keep doing those things good that we're already doing. So if you think about a high-level strategic planning process, the first question says, how would you integrate feedback as part of the planning process? And so just to share an example of how we do that here on campus, obviously we've shared we do lots of things, but one example that's coming to mind is during our annual managers meeting, we do a SWOT analysis, which means strengths, weaknesses, opportunities, and threats to gain feedback. Feedback is categorized and shared across the organization and implemented through Pdsas and improvements as part of our strategic planning cycle. And Pdsa stands for Plan, Do, Study, Act. And so we actually have a document here on campus that is a Pdsa form. And so anybody, you don't have to be an improvement to do a Pdsa. Anybody here on campus who has gotten feedback as part of the planning process can implement those Pdsas across the organization. And the form really guides them through, how do you plan it, what are you going to do, and then we study and we act upon that. And so a lot of the Pdsas we've done over the years have birthed great improvement projects. And then sometimes you might do a Pdsa cycle and you think, that didn't work. We need to go back and we need to revisit and maybe do another Pdsa or look at how can we really implement those changes that are going to make an impact. The next question is, what would you do if you receive feedback that was not part of the strategic planning process but needed to be addressed sooner than later? So I know Lizzie just talked to us a little bit about our incident accident reporting tool. So I'm going to give her an opportunity to answer the second question and tell us, what do we do with feedback when it's not part of the strategic planning process?
So I think the biggest feedback we get that needs to be addressed immediately is when we have things like slips and falls. So this winter we actually had one of our coworkers who fell in the parking lot, and he got injured. And so what happened is we put that into our feedback system immediately. We wanted it to be addressed immediately. And facilities came over. They came over and figured out what needed to be done. Did it need to be de-iced? Did they need to put more sand out? Did they need to plow? And they made sure that wouldn't happen to anyone else. Luckily, it is bad it was a coworker, but luckily it wasn't a customer owner who slipped and fell, which it does happen. And when that happens, again, we want to get it into that feedback and we want to address that feedback immediately. We don't want anyone falling. We don't want anything happening to our customer owners when it's our job to provide them a safe place to go.
Awesome. Thank you so much for sharing that. And so it's really been, it's been good to be able to say, hey, we do have a strategic planning process. We are always looking at how we can grow and change. But obviously, if somebody slips and falls in the parking lot, we're not going to say, hold up, that's not part of our strategic planning process. We do take action. So it does happen, those unexpected events, and we are prepared to be able to reach out and make sure, that the employees and customer owners get their needs met, as well as making sure, for example, in Alaska, it snows a lot in the winter and it's very cold. And so even though we may be used to walking in snow and walking on the ice, the slips and falls do happen here in wintertime. And we definitely don't want to wait for our strategic planning process to address those issues. So that was a great example. I'm happy that you shared that. SCS leadership not only listens and cares about the voice of the customer, but they actively participate and lead by example. And we talked a little bit about this when I mentioned that fact that core concepts is driven directly by senior leadership. They're actually the ones who get up here on stage, they teach us, they participate, they walk alongside with us. So it is really important that our leadership and to really stress that they actively participate and lead by example. Lizzie, do you want to talk a little bit about leadership and voice of the customer?
Well, you stole my example.
Yeah.
So I think it's just one of the biggest examples is core concepts, because it is so great. When you come into the training, you have no idea what you're going in for, and you learn that it's our CEO that's training it, and she's modeling the behavior, and it makes you care so much more, seeing how much our leadership cares and seeing how much they care about customer owners is amazing, but seeing how much they care about us as employees is even better. It's really incredible.
So a little bit about leadership and voice of the customer is taking the time to be present and listen to others with grace. And we both have kind of shared that. And I feel like, there's times that I've been walking in and out of the building and I'll see our VPs or our CEO, and I'm never afraid to say, hi, how are you doing? So having them present and having them listen to us is really great. We talked a little bit about modeling core concepts and the things that we learn there. It's really highly encouraged that all the things we learn in core concepts, that we model it in the organization. So when you see senior leaders saying, hey, we're using our left-hand column, or, you know, hey, I'm a circle or I'm a square, which are all parts of core concepts, it's really great to know that they're not just up there saying it, they're actually living it out every day with us. Being involved in discussions that may or may not involve other customers or stakeholders. Our VPs are, and senior leadership CEO, they all participate in a variety of boards, meetings, committees. They are very actively involved, and so that's really nice to see them, especially during the committee structures and the committee meetings, and really being able to interact with them as a team. Becoming articulate in the tools that support customer listening points. That's kind of what we shared a little bit about we have special tools that we use, and we are very intentional about making sure the people know what those tools are and they're trained on those tools, and leadership is very supportive of that. The other thing is empowering others to use their voice. So one of the things I can say I really appreciate about leadership is they do encourage us to fill in those gaps, to make those changes. And when they share, you know, we talked about in core concepts sharing stories. It's really nice to be able to hear them share their own personal and professional stories as well, and how they were successful and how, you know, they were able to fill in gaps. And it is really empowering because it makes us feel like we have a voice and that it's safe to share our stories and it's safe to grow in the organization. So like I said, just to kind of sum it up with our leadership and the voice of the customer, is that they aren't just up there dictating orders, they're actually here participating, and they're talking to us and they're listening to us, and they're modeling it here on campus, and they are present, and we physically get to see them. And it's been really helpful, I think, and had a great impact on our workforce. Sorry about that.
So one of the biggest improvements we have made recently at SCF is recreating our customer experience standards. So previously we had used a third party for our customer experience standards, and what we noticed is we started to see a really big trend in staff attitude complaints, specifically related around front desk, or those frontline people, the first people customer owners talk to. And so we got that feedback, and we knew we needed to address it. We decided to recreate our customer experience standards, make them so that they related to the Alaska Native American Indian cultures, and they worked better for SCF. And so when we started this process, we knew it would be important to also hear the voice of the employee. So what we did is we actually went out and we talked to employees, and we asked them at the front desk, what do you have anxiety about? What's really hard for you working at the front desk? What are you afraid of? How do you handle difficult interactions? What do you do when you have an upset customer? And we gathered all that feedback, and we put it all together, and we created these new RELATE standards. And this is our standards for a better, positive customer experience. And so we created all these standards, and we needed to deploy it across the organization. So we actually taught our managers first. So we had a manager meeting, and we brought all our managers into one place, and we taught them RELATE. And then it was their responsibility to take RELATE and bring it back to their departments. And so managers shared it with their departments and got everybody on board. But we knew that wasn't enough, because we did have all those complaints just specifically around frontline. And those are your front desk admin, the people who answer phones and schedule appointments. We had our IT technicians, quite a few people from finance who talk to customer owners, and we had all those people come to a specialized training that we created just for that frontline staff, so we could really address that. And in that training, not only did we teach them our standards, is we asked for their feedback, and we asked them, what was a difficult interaction you had that you couldn't handle? And we worked through these scenarios so that we knew our employees weren't afraid of dealing with customer owners, because working at the front desk is a lot of anxiety. It's very anxiety inducing to be at the front desk and just not really know what to expect. So we wanted to help remove that fear from our employees. Along with that specialized frontline training, because we do have a lot of rural clinics, and like Stephanie said, we can't expect people to just drive here. We have places where the only way to get there is by plane. There's no other way. So we created a specialized online version of RELATE, and we actually are getting ready to deploy that to all of our rural employees so that they can be on the same page as us, because we want everybody in the SCF system to be able to receive the same care and have the same expectations. The last thing we're doing with Relate is we actually are getting ready to roll it out to customer owners. And we want customer owners to know what they should expect. We're going to give them these standards: respect, engage, listen, advocate, thank, and encourage. And we're going to tell them, when you come to your doctor's appointment, this is how you should be treated. This is what you should expect when you call to make appointments, because we want them to be empowered to not only get great care, but be able to provide feedback when they don't get the care that they should expect to get.
Absolutely, and that's so important.
Yes.
When you really think about it, it is very important.
It is.
So thank you so much, ladies, for all of the information that you provided us today. I know our viewers today have been very engaged throughout this process, so we really appreciate that. And just before we go ahead and just kind of tie all of this information together, I would like to just ask you, as the viewers, is there any other information or anything else you would like to learn from this webinar today? But just while we're waiting for you guys to go ahead and give us those responses through menti.com with code 49203, I was going to kind of just recap everything that you guys have shared with us today. So thank you again. And so really, just to kind of recap why the voice of the customer is important here at Southcentral Foundation, we identified who those customers are, discussed the ways in which SCF listens to the customers, ways to access the voice of the customer, and how the voice of the customer is being used for improvement at Southcentral Foundation. So again, thank you, and again, menti.com, enter code 49203, and it looks like we've got some questions. Someone said, we would like to learn more about how to implement the NUCA model. Do any of you ladies have a response to that?
Great question. So I think what we could do is connect you with someone in our Learning Institute, and they could get you some more information on what the NUCA model is and how to implement it, so we can connect with you and get you some information.
Wonderful. Survey examples would be great. Do any of you guys have any survey examples?
Sure. So we've kind of given a few survey examples already. So we do the employee engagement through a third-party vendor. Mm-hmm. Another tool we use is SurveyMonkey. So I mentioned earlier about 360 surveys, but I didn't really talk to that. So another survey that we use is a 360 survey. And what that means is it gives a chance, it's like a peer review, right? So you get to, so for example, I get 360 surveys as improvement advisor across workforce. And my supervisor, I provide a list of people that I team up with across the organization. And during evaluation season, my supervisor will pick, a few people out of my list, and then they'll send them the 360 survey through SurveyMonkey, and they get a chance to evaluate my performance. How do they enjoy working with me? What am I doing right? What am I doing wrong? So it gives me a chance to get feedback from my peers. So employee engagement survey, we use SurveyMonkey. We talked about the customer satisfaction surveys. And one thing that I'm not sure if we mentioned is that we are excited that we went from paper to tablet. However, we recognize, especially within our elder population, not everybody is comfortable using electronics. So we do still provide paper surveys in the clinics for those who would like to fill those out. And so that's just a few of we're a survey type of organization. And so those are just a few of our big surveys that we use. We also have a NUCA conference every year, an annual NUCA conference, which will be coming up here in June. And it talks a little bit about, it teaches all about our NUCA model and what we're doing. Mm-hmm. And when you go to the conference and you register in classes, or anytime we do courses here on campus, everybody gets a pre and post survey. What did you not know and what do you know now? And so basically we take that opportunity to say, hey, here's what people need to learn. And so even in our own trainings, even our NUCA conference, our quality management courses, whatever, we are still surveying and we are still looking at what's working and what's not working. So that's just a few examples of some of the surveys we do here on campus.
Wonderful. And you did mention the NUCA conference, and that would probably be a great way for those of you interested in learning more about our NUCA system of care here as well. It looks like we have some additional questions here, and one of them was how to standardize data input collection for improvement. They said, so interesting how you guys do that, so thank you. And then also, what resources were used to implement these initiatives, existing resources or other resources?
So kind of what we talked a little bit about implementing initiatives, improvements, is it starts with looking at our performance development plans for individual employees. We also have the committee structure. So for example, we have like the HR committee who looks at Alaska Native American Indian turnover rate and employee retention rates and things like that. So we take those and we take them back to our committee structures, we let them look at them, and then they offer suggestions and they offer recommendations. And so it's basically, it's an ongoing part of our strategic planning cycle. And so once we get the feedback from everyone and the knowledge and committees have looked at them, then we actually do those PDSAs as improvement projects. We have project team charters that bring people across the organization with a specific aim or a specific goal in mind or a specific measure. So one of the things that we've implemented recently over the past year is physician recruitment. So it's going to be nationwide. There's going to be a shortage in physicians. And so what we have decided to do is we want to start early, right? We don't want to wait till late in the game. So we have a physician recruitment project that we're working on in ways that we can beef up recruitment and bring more physicians into the organization. So it really depends on, when we talk about existing resources, we have forms, we have tools, we have groups across the organization. But it really depends on what that department or division is looking at the time. And so we would make sure each person has their own unique resource that's appropriate for them at that time.
Wonderful. Thank you so much, Stephanie and Lizzie. Again, I'm not sure if any more of you have any additional questions, but it's menti.com, code 49203. We'll give just maybe another minute here to allow you guys to ask some more questions before we finalize our presentation. But how has it been for you guys working here at Southcentral Foundation? What do you guys love working about here?
I love working here. This was my first real job, my first adult job, and it's very exciting. I didn't think coming here I'd find a career path I wanted to go down, but it definitely has changed my entire life working here. Personally, just having the resources available and the trainings, and then having such a close-knit group of people we work with, and just getting to learn so much. Getting to learn so much about data and improvement and how it works has just been, it's been really great. I love working here.
Yeah. How about you, Stephanie?
Sure. So for me, working at Southcentral Foundation, like I said, I've been here for a little over a year now, and it really has been a life-changing experience. As I mentioned before, I'm a member of the Cherokee Nation tribe in Oklahoma, and so I'm originally from the lower 48, and I have worked in the workforce for a very long time and had an opportunity to work with multiple different tribal organizations and public organizations and out in the community. But I can honestly say that when I came to Southcentral Foundation, it was a little bit hard to really understand when I went through core concepts that people actually cared about me, because previously in the workforce I was just a number, I was just an employee doing a job every day. But here it's like, hey, we want to know who you are. We want to know what your story is. And we do huddles and we do check-ins, and it's not custom in the normal workforce to be doing those things. So to be able to sit with your team and share your stories and check-ins, for example, when we start meetings here, we let everyone do a quick check-in. Hey, how are things going? And that sets the tone for the meeting, because people are really going to care about, hey, did you have a rough day? Or hey, are you doing great? Things like that. So being able to learn that what's going on in my life and have that work-life balance here on campus and that support. SCF is a strong supporter of family as well. And so being able to really say, hey, I love my job, I love coming to work, and not being afraid. If my son is sick and I need to call into work because my son needs to get a doctor's appointment, I'm not afraid that my boss is going to be mad. I'm not afraid that I'm going to get in trouble at work. My boss instead is going to be like, oh my gosh, we're healthcare, we're all about family. Take care of your needs first. We'll be here when you get back. And then you have teams. So in those moments where you might have to step out, for example, I was gone for 6 weeks for surgery. My whole team took care of everything while I was gone. It wasn't like I came back to a pile of work. And so really being able to have that team environment and to be considered as somebody that matters and have that work-life balance, It's not that we just say it and preach it. We really are about relationships and whole wellness, both for people, families, and the whole community. And so it has really changed my life the past year. And it was a little hard accepting that, oh my gosh, you really care about what I think. But now it's like awesome. You know who you're working with. You know what to expect. And I want to get up and come to work. So it's been really great.
That's wonderful. Thank you so much, ladies, for sharing that. I know I love working at Southcentral Foundation, too. But it looks like we did have a question come through from one of our viewers here, and it said, what was the length of time to have NUCA running smoothly and to have all staff and clients on board with NUCA?
So like I said, I've only been here for about a year, so I apologize that I am not sure exactly the time frame that it took to get NUCA up and running. I know that we share a floor. I work on the same floor as the NUCA Institute, and it's amazing, and they're doing great, but I don't have the timeline. That is a question we might could get back to you on an answer. Do you know, Lizzie, the timeline that NUCA took to get up and running?
I'm not sure, but we can get that information and connect with you and let you know so we can get you that answer.
Well, it looks like that might be all of the questions that we have today. Thank you, everybody, for joining us for the Southcentral Foundation Voice of the Customer webinar. We are greatly appreciative for you joining us and learning about what our organization has to offer you, and we hope that you can take this information back and share with your organizations as well. So thank you very much, and Quiana.
Thank you.
Thank you.